All right, we're just going to start. I think I pressed the right buttons, but the show must go on. So for those of you who don't know me already, my name is Dr. Brian Skotko. I'm the director of the Down Syndrome Program at Massachusetts General Hospital. Now we're going to get feedback. All right, let's see. Let's just keep on talking and see what happens. So it's there, my colleagues and I, we get to see about 600 to 700 patients with Down syndrome of all ages every year. And I'm really excited to share with you a new resource that we've created called Down Syndrome Clinic to You. I'm just curious, any of you, have you used Down Syndrome Clinic to You yet? Have we had any users? We have one. All right, fantastic. Two, fantastic. I hope by the end we'll be able to see how, with just a click of a button, your loved one with Down syndrome can be up to date on all the latest guidelines for people with Down syndrome. So while I get to run a specialty clinic with my colleagues, no longer do you need to come to us, we're going to come to you. And that's going to be the point of our talk. Pat Bauer is a parent who has a loved one with Down syndrome, and she put it in focus for us. She says, we live in an era where the offer of prenatal testing is universal and the termination of pregnancies involving Down syndrome is commonplace. But families of people with Down syndrome often say they worry that the medical establishment has passed them by. They feel marginalized, unseen, and unserved. Families of people with Down syndrome aren't looking for admiration. They're not looking for pity. They just feel a critical and urgent need for adequate healthcare for their loved ones, which is the right of every American. And this is making sure that your loved one with mosaic Down syndrome has the most up-to-date medical care that they could get. As you know, for those of us who take care and specialize in Down syndrome, the healthcare that people with mosaic Down syndrome should receive should be unparalleled and not compromised, and it is equivalent to the care that people with non-mosaic Down syndrome receive. So we have the same guidelines, and we need to make sure they're adhered to. We've never had more people with Down syndrome in the United States, 217,000 Americans in the United States and nearly 4 million people worldwide. And we actually have these Down syndrome specialty clinics. So there are about 71 Down syndrome specialty clinics in 35 different states. But here is the reality. When you take all of us together at maximum capacity, we can only serve up to 5% of the Down syndrome population, which means 95% of people with Down syndrome do not have access to one of our clinics. And our clinic at Mass General Hospital is closed. We're at full capacity because we're seeing so many people with Down syndrome. One of those people who can't access a Down syndrome specialty clinic is my own sister, Kristen. She lives in Ohio, and the type of care that I'm able to provide to my own patients, she's not able to readily get because it's more than 2 hours to her nearest Down syndrome clinic. So this led me to think, how are we making sure that everyone with Down syndrome is up to date and getting the best medical care? And I hear from parents, oh, we're so lucky we have a great primary care doctor. I am so glad you have a great primary care doctor, but the reality is most primary care physicians have just 1 or 2 patients with Down syndrome in their practice. And it is impractical and unreasonable to think that today's primary care practitioners could stay up to date on everything related to Down syndrome. It is a full-time job for those of us who take care of people with Down syndrome, and research has shown that less than 10% of patients who are just seeing a primary care doctor are up to date. And when parents hear, oh, everything is going wonderful with your loved one, what we don't realize is what is the primary care doctor not realizing under the surface. So again, we want to play offense so we're not playing defense when a medical crisis happens. We were lucky enough before the pandemic to get a grant from a government-funded agency in order to build an automated online service called Down Syndrome Clinic to You. And I want to share with you how this works. It wouldn't have been possible without a team effort. I'm so grateful for so many clinicians, people with Down syndrome, and the computer engineers at my hospital who created this. But I'm equally grateful for all of those individuals who are part of this process. Once a month for 3 years, they came together to help us build it. These are the experts. Marilyn Bull wrote the American Academy of Pediatric Guidelines. Brian Chicoine wrote the adult guidelines for people with Down syndrome. And then we wanted to make sure that primary care physicians who were trying to help them do their jobs were involved in the creation of this. So these are 4 primary care doctors around the country who just have 2 people with Down syndrome in their practice. And then we wanted to make sure that real parents were helping us build this. And these are all parents and including people with Down syndrome who helped us create the product together. And I have to say the product wouldn't be what it is today without the fingerprints of all of these individuals. So if you have a phone or a tablet and you want to start to ignore me and just play around on your phone, that is what I'm happy that you do. So if you go to DSC2U.org right now, you will find that the website is there. It is mobile optimized, it's automated, it's a direct-to-consumer tool in English and in Spanish. What it is not is telemedicine. You're not having a telemedicine appointment with me or any of my colleagues. Instead, you can literally input any concern you have about your loved one with Down syndrome, and you will get the most specific, customized answers that you deserve. Here's how it works. Once you sign up, there is an intake form. Now, in the intake form, the more answers you complete, the more suggestions you're going to get. So here you could see that it's asking for the name of a person, and then it's also asking for the date of birth. The computer then will have branching logic. So if we know that you have a 40-year-old with Down syndrome in your family, we're going to ask you the 40-year-old questions. If you have a 3-year-old with Down syndrome, we're going to ask you the 3-year-old questions. And after practicing medicine for all these years, and I'm a medical geneticist, I'm just a glorified pattern recognizer. Because when you come to see me, I'm asking a bunch of questions. And if you say, my 8-year-old with Down syndrome is snoring at night and tired during the day, I have learned that those 3 symptoms might mean obstructive sleep apnea. And out of my mouth is, we need to get a sleep study if you haven't got one already. You don't need to make an expensive visit to Boston for me to tell you that. We have downloaded the brains of the best clinicians in the Down syndrome universe and put them into these algorithms. So all the questions you have, either solo or in combination, will lead you to your customized checklist so you could get that done. I'm going to show you on the left-hand side, you could see all the different chapters that you could complete. Medical questions, you could see there's no fill in the blank, there's no essays. You hate to write them, I hate to read them. So it's just check, 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 right? So which are the following symptoms does Kristen experience in the past month? We know that those symptoms in combination can lead to things that go along with this extra chromosomal journey. In section 3, we heard today about all the co-occurring mental health conditions that could exist for people with Down syndrome, behavioral issues that could exist. Sometimes behaviors are the only signal from our loved ones with Down syndrome. There could be a medical condition going on. So if you complete that behavior section, you'll see what you get. There's a section on nutrition. We have Down syndrome nutrition specialists around the country. You don't have an opportunity to see one of them. We could program in their questions and their responses. When people with Down syndrome pass the age of 13, we want them to be as semi-independent as they want and deserve to be. But how do you become semi-independent? What are those skills you need to learn? So we break all those down and you'll see what you get as a response. We also ask what has been done already. The last thing you want is to get a recommendation. You're like, we've already done that. So we're building on your diagnoses that are already in place, and we're building on the symptoms and signs that your loved one already has. When you get through that checklist, again, completing as little or as much as you want, 5 minutes to about 30 minutes, and you press submit, you will get access to your own password-protected portal. And this is going to be a scrolling website, but I want to show you what it would look like. So the caregiver would most likely complete this. You can co-complete it with your loved one with Down syndrome, and many families do that. But the first section, number 1, is the caregiver checklist. Then you click on number 2. You're going to get the checklist to bring to your primary care doctor, because together we're going to turn that primary care doctor into the Down syndrome specialist. In the upper right-hand corner, if you click on language, everything will change to Spanish. Could also download anything into a PDF so you could print it and or email it as attachment to anyone who is involved in your loved one's healthcare. So what is on Molly's sample checklist? The first section is labs, tests, and procedures that should be done based on what her mother responded. You could see Molly is due for an eye exam. She has to get a celiac screen. She's got to get a sleep study, etc. And I've heard from many of you that said, if you're going to recommend something for my kid, you better tell me why you're doing it. So if you're one of those parents who want to know why, you could see every recommendation has that green Y button. So if we look at thyroid function tests and we click on that Y button, it will expand and it will tell you exactly what you inputted and why we're recommending it. So you indicated in the past 12 months, Molly has not had her thyroid levels drawn, and individuals with Down syndrome are at significant risk for developing thyroid problems, which are important to treat. Experts recommend that thyroids be checked annually. The other thing we learned, especially from my own mother's feedback, is we don't have time anymore. I don't have time to get on the internet. I don't have time to find things, and we're missing things that are out there. So as part of this opportunity, what we did is we curated all medically credible information that's in the universe, and we're delivering it to you when you need it. So now that we're talking about thyroid, if you click on the first blue link, it will take you to our colleagues at another hospital who's created a 20-minute video just on thyroid and Down syndrome. No need to look for it. Here it is. This is what you need to know. The next link will take you to the National Down Syndrome Society's webpage with a fact sheet about thyroid. So each recommendation will come with the specific links that you need to know. Click on it or don't click on it as you think it could be helpful to your family. In the Down syndrome community, we're responsible for learning hundreds of conditions that could go along with Down syndrome. Oftentimes, these are overlooked, or as we heard from Dr. Anna, you could have diagnostic overshadowing, where we just see Down syndrome and we don't see the other conditions underneath there. So there's hundreds of things that could be programmed here, but we're going to highlight the ones that Molly's mom entered that might be significant here. Molly might have depression based on how Molly's mother responded. She might have some specific arthritis that could go along, chronic constipation. The list goes on. But you could see here that in addition to clicking Y, if you want to know, well, what are the resources? Many parents said, I don't have time to read the whole books, so we will tell you what chapter to go to in which book, or what pages to go to in which book to just get to the symptoms that we're talking about. In the lower section, just as those of us who run Down syndrome clinics are more than just medical clinics, just ordering tests, we also want to maximize the health and wellness. So we get a lot of questions about dating, puberty, boundaries, weight management, questions about OCPs. What are the risks for people with Down syndrome? What are they not about Down syndrome? All of those health and holistic questions might appear here. And these are just some of the examples of what might appear in the sections. Molly's mom did complete the nutrition section, so she's going to get Down syndrome specific nutrition recommendations. Osteoporosis could go along with Down syndrome, and based on her mother's input, it doesn't look like she's getting enough calcium. Here's how much she should get, and here's a handout of how she could get it. Molly wants to be as semi-independent as possible, but we break that down into skill sets. These are things that we talk about in clinic, but easily transportable to an online mechanism. So you can see one of the things Molly wants to do is learn how to describe how she's feeling to the doctor. She wants to learn how to take medications on her own. She wants to learn how to use public transportation on her own as one of her skills. But it's nice just to have those goals, but each one of these goals, if you click on the resource, will take you to a resource that's ready to be printed and downloadable. So this is a social story, for example, on how to do transportation training for people with Down syndrome. Again, it's been on the internet forever, but no one knows where to look for it or how to look for it. So we will give you that link with the skill set that your loved one with Down syndrome wants to work on. We're asked questions, how best do people with Down syndrome learn math? How best do they read? How do their brains best process literacy? Okay, all those questions we programmed in. I've been fortunate to be attending lots of Down syndrome conferences and listening to all my colleagues. I take notes, and any resources that they have, I just program into this highway so that if you miss a conference or if you miss a resource, we'll be able to update it through here. You see, Molly wants a job. Well, there are lots of resources for people with mosaic and non-mosaic Down syndrome to get the job that they want. And here are all the resources to help them build resumes, to use resource packets, to talk to their employers. You can see that's programmed in. And again, we have lots of different Down syndrome organizations, and these are just a few that they want access to. You might say, what's an ABLE account? How do I sign up for SSI? What are all those guardianship things I need to think about or not think about? All of those things to sign up for, all those governmental services in the United States, we've programmed it here as well. And with a click of a button, this is an example, it will be converted to Spanish if that is the language of choice. Now, if you're back on your portal and you click on primary care, this is the same recommendations, but now written in doctor talk. So you could take this to the primary care physician when you next have your appointment. You could see we're having a conversation with the physician, say, here are the lab tests that need to be ordered, and here are some of the co-occurring medical conditions that we should look out for so we don't have that diagnostic overshadowing. So we see through Down syndrome and make sure people with Down syndrome get the treatments that they deserve. And then we've created a microsite for the primary care physicians so that they have access to all of the resources that we have programmed in, letting them know which handouts we recommended for Molly's mother. Like all good research, after we created it, we wanted to test it to see whether it was effective. So we got money in order to do a randomized controlled trial. And what this means is we had over 200 families who we never met sign up on the computer. And then they told us through a survey how healthy or unhealthy their loved one with Down syndrome was, how up-to-date or not up-to-date they were. Then they were randomized into Group A or Group B. Those in Group A got access to Down Syndrome Clinic to You. Those in Group B did not. Then we followed them for a year. They all had their primary care appointment, either pediatric or adult, all ages. And then we followed up with them 2 weeks later and 7 months later. Our hope and hypothesis was those in Group A would be healthier and happier because they had the guidance of this instrument. Those in group A would be what normally happens, like for my sister with Down syndrome. Then as a take-home consolation prize at the end, everyone in group B got access to Down Syndrome Clinic 2 when the study was over. We measure all of the results that should just be standard. Everyone with Down syndrome absolutely unquestionably should have these done, mosaic or non-mosaic, and we measure whether we could build them up to date. The take-home message now that the research is done is Down Syndrome Clinic 2 was effective. Without ever meeting families, with families simply going through the guidance online, we were able to turn primary care doctors into better Down syndrome specialists. This is a slide that shows there was a 1.6-fold increase out of the 5 in adherence to the guidelines. But more than just saying it's effective, I have to convince my mother that it would be worthwhile, right? And she's a tough one to convince, let me tell you. So we asked parents who completed it, was it easy to understand? And you could see 97% of them said yes to some extent. Would you recommend it? All parents would recommend it to some extent. And did you use the links? Spent all those time doing those links. About 3/4 of families clicked on the links, and about 1/4 said, that's okay, we'll just do what you tell us, and we don't have to click on the links. Then we surveyed primary care physicians. We were hoping to make their job easier and not, oh, here goes Harvard again trying to tell us what to do, right? And we had a sigh of relief when we heard from primary care physicians saying that they did discuss the plan, they agreed with the recommendations, and they were interested in the results. And this is in gratitude to the primary care physicians and the parents who helped co-create Down Syndrome Clinic 2 to get that language right, to say we're here to be helpful, to honor your patient-doctor relationship, but also to make it easier. On a scale of 0 to 10, with 10 being very helpful and 0 being not helpful, the primary care doctors and the caregivers rated it about a 7.8. We have now published the results in this paper. What I'm so excited about is I've had the opportunity to write a lot of nerdy papers, but the co-authors on this include the names of people with Down syndrome and their parents and primary care physicians. So we truly were co-creators in this. And if you want to read all about the nitty-gritty, that URL will take you to the full paper for free. After we finished our research, we then wanted to launch it. We just didn't want it to sit behind an academic center, so we made it public. And we are gratitude for the first 3 years, it was funded by the Lumind IDSC Down Syndrome Foundation. And because of them, it is now launched. So if you go to your phones or if you go to your tablets and you go to DSC2U.org, this is what it currently looks like. In the upper right-hand corner where it says EN, you could change it to Spanish if that is the preferred language. Right now, Down Syndrome Clinic 2U has 3 low-cost options. One-time use is you go in, you complete it, and you get your password protected, one recommendation, and it's yours to look at for the rest of your life. The 1-year unlimited view is like a gym membership. You can go back as often as you want as you develop new questions or today something happens in your loved one with Down syndrome life. The more you enter, the more customized responses you get. Annual subscription is you're just in it to win it with us for a long time. As we continue to update the algorithms, you come back as often as you want, and it just renews on an annual basis. Down Syndrome Clinic 2U is operated from behind the firewall of our Massachusetts General Hospital firewall, and it also means we need to maintain the cost. So we're a nonprofit hospital, and any costs we get go to maintaining the product. Any extra costs, which we don't have, will go to improving the product as well. So I need your help. Many organizations are helping. So a lot of Down syndrome organizations say we do not have a Down syndrome specialty clinic in our backyard. We do all these walks, we do all these runs. What's better than the gift of health? So if you go to this micro page, you might find that your favorite Down syndrome organization is offering discounted codes to you as members, and we're really grateful for that partnership. This could potentially be my lifetime work if you think this could be helpful, and I'm having conversations with insurances in order to get insurances to cover. We're proud to have 2 insurance plans completely cover this for people with Down syndrome. If you have those, you type in your insurance ID for your loved one with Down syndrome, they get it for free. It takes about 50 to 60 conversations I've found with each insurance company to finally get them to approve it. So if your sister-in-law is the CEO of an insurance company, please let me know. I just want to go right to the top, right? So together, it's a win-win. Insurances want to make sure people with Down syndrome are healthy because they rather play offense rather than defense. And by following the guidelines, we can keep them up to date. Here's the honest truth. Down Syndrome Clinic 2U will only succeed if we do this together. So we've created it, we've launched it, but until we get enough users, we won't be able to continue to maintain it. So I need your help. One way you could be of help is just spreading the word about Down Syndrome Clinic to you on social media. We're such a social community right now, and I'll show you how you could do that. If you are a group leader and you have e-newsletters, we have ready-to-go information. If you have in-person events, we have flyers that you could give out. And also, if you would like to offset the cost or use it yourself, that would go a long way. Social media, if you go to dsc2u.org/social media, you'll find all of our blurbs. You could just copy and paste and set them going. Or if you follow us online, if you just share and push it forward, that really does help us. You could be our ambassadors as well. We also created a whole social media toolkit. And so if you take a picture of this URL code, it will, or this QR code, it will take you to all of the write-ups that you could use in any line of communication that you have with families that you're connected with as well. That will also include giving you access to our flyers, which are available in both English and Spanish, which you could distribute to local families at your local events. Then I'm also happy to share, because it's summer and we're all happy during summer, we have a discount code. So if you go online right now and you type summer23, you will get $23 off any plan that you want. That will expire on September 23rd, 2023. That URL code will just take you to dsc2u.org. When you get to checkout, there'll be an opportunity to put summer23. You put it in there and you'll get all access to it. Again, I want to thank so many of you who inspire me so much online with your stories. This is how we could stay in touch. I want to thank Colleen for her support and again, inviting me to present this to you today. Thank you so much. I think I'll maybe take one or two questions if you have them, and then we'll get ready for our next speaker. Yes, please. Yeah, thank you for that. We've been connected with some of the doctors in California and some of the parents, and they've spread the word to the regional centers, and we've given them the packet to kind of advertise. But if you could remind them and continue to let them know to advertise that. We've also given them the opportunity if they want to buy discount codes for their members. They haven't taken that opportunity yet, but yes, we would welcome a partnership. All right, great. Sounds like a little bit of work, but it might be worth it.
Yeah, it looks like it's statewide, not.
Great, thank you. Any other questions? And now I just have to ask, and you don't have to entertain me. Those of you who didn't do it yet, how many of you might be interested in DSC2U or think about it for your loved one with Down syndrome? All right, we have hope. All right, terrific. Thank you again so much. Our next speaker, I'm going to bring up a good pal, Dr. Bill Mobley, who's going to tell you all about Alzheimer's-like dementia in individuals with Down syndrome and the associated risks.